in 2010, I had a cousin that went to a party. The details are kind of murky. I know he was invited by a female. He left out and gunshots rang out. He tried to get into a car. His friends heard the shots, pulled off, left him. He was shot in the head and only had to go to that funeral. That was like one of the ones that really impacted me then.
Tragic incidents of trauma occur with life-changing results. They are burned in the memories of everyone involved, including our colleagues right here at the University of Chicago Medicine. When trauma occurs on the south side of Chicago, many victims have limited resources available to them. Our community needs access to trauma care on the south side, and for that reason, the medical center will become a Level 1 trauma center for adults in May 2018. Pending approval by the Illinois Department of Public Health, the medical center will be able to treat adults who suffer injuries from serious falls, motor vehicle crashes, gunshot and stab wounds, and more. A newly constructed emergency department, opening in December, will improve the emergency care that UChicago Medicine already offers. But becoming a great trauma center will mean more than treating people with life-threatening injuries. The University of Chicago Medicine's vision is to be a trauma center that partners with the community to address the factors that lead to many injuries.
The ideal trauma center is one that's like a firehouse. It's there, you know it's there, it can provide care when you need it, if there's a fire, or in this case, when there's a trauma. But the ideal one is one that you never need. And if we can partner with our communities that we serve on the south side and provide a great opportunity to prevent violence and prevent injury in the first place, that'd be the vision of the ideal trauma center.
So who will we treat? And how will trauma care change the medical center? Those who have worked in adult trauma care explain.
Trauma centers across the United States, the #1 admission is falls. But here in our area, again, we live in a unique area that we will see a lot of penetrating trauma, which are our gunshot wounds and our stab wounds. But we still anticipate we'll see a lot of falls, motor vehicle crashes, motorcycle crashes, industrial accidents, and along with our penetrating trauma. So we have to be prepared for anything that comes through our door.
With respect to the internal workings of the hospital, we'll be providing trauma care 24/7, 7 days a week, 365 days a year. And in the context of that reality, that actually means that we have to have a certain pace of care that we provide our patients. And unlike some programs that may only touch part of the hospital, trauma patients and the care of those patients touches every aspect of the hospital. And in many ways, I think that gives us a great opportunity to really examine our current processes for just about everything we do and make it better.
I think becoming a trauma center will surely make us better. It's already forcing us to look at our care processes and think about where do we need to build in redundancies that we haven't in the past. Where do we need to really think about our resource allocation and how do we move so that we've got more consistent resources on the weekends? We're already seeing some opportunities and starting to address those.
Even though adult trauma care will bring a new set of demands on the University of Chicago Medical Center, faculty and staff have a track record of successfully meeting large challenges in providing new and different kinds of care.
So in the 5 years that I've been here, we've come together as an organization to execute on some big initiatives. Like when we opened the CCD building, that's what it's really going to take for trauma. Bringing together a multidisciplinary team, surgeons, advanced practice providers, nurses, therapists, pastoral care, social work, case management. I mean, this just brings together the best of all of us and really will bring us together as a team while we're meeting our community's needs. There's nothing better.
To Kiwan, a trauma center will be more than a place where people go to begin healing their wounds.
Having one here, just knowing that it's here and that there's something on the south side for the people, just gives better hope for the future.